It's me, Maureen. I'm the best nurse manager here in the best hospital. Next, we have our best senior staff nurse, Denise. And this is our new nurse, Yingwei. And lastly, our patient, Miss Tan, who is diagnosed with depression 2 years ago, recently diagnosed with stage 3 breast cancer.
The hospital already, so we discharged from us. Okay.
Morning, sister.
Morning, sister. Okay, today I let you all know. There's not enough staff today, so you all know what to do.
Okay, you know what to do. Okay, sister.
So Sim, you go and help Miss Tan do her wound dressing later. So she came in for breast CA stage 3, mastectomy Tan. So her wound dressing is due today. Okay, so you just check on her compliance, okay, and her medication, and whether she's feeling any pain now. Her pain is gone all okay. Then she has IMH appointment next month, so you just just leave it for next month, okay? Then they will follow up with it. Can?
Hi, Miss Tan. For today home visit, right, I help you mainly do your wound dressing lah. How are you today?
Okay.
Okay. How do you feel your pain now?
It's okay lah. I won't feel the pain anymore soon.
Because you take your pain medications, right? Can I see your pain medications?
Okay, I take for you.
Can, sure. This is her Facebook, is it? Huh? 什么? All things will come to an end?
Sorry, everything a bit messy.
Oh. Wow, so many missed calls. She okay? It's okay that I check your wound now.
Oh, okay. Okay, let's go.
Miss Tan, your wound is healing quite well. So I'll see you next time. Maybe next week. Goodbye. Bye-bye.
Bye-bye.
Should I inform my senior about this? I think no need.
It's time to end this.
Maureen, and together with me we have Yingwei, Isabel, Denise, Sherry, and Jiaxing. So we will be bringing you guys through our case scenario with regards to enhancing patient safety in the healthcare setting. So before we comment, so here are our objectives. So firstly is to recognize the magnitude of problems if patient safety is compromised. And secondly, to know how to provide safe care such as using SBAR, providing proper guidance, and also giving holistic care. So we will be adopting the Swiss cheese model by James Reason for our presentation. So he proposed the image of Swiss cheese to explain the occurrence of system failures such as medical mishaps, to analyze medical errors and patient safety incidents. So according to the metaphor, in a complex system, hazards are prevented from causing human losses by a series of barriers. So each barrier has unintended weaknesses or holes, hence the similarity with Swiss cheese. The weaknesses are inconstant, the holes are open and closed at random, and when by chance all holes are aligned, the hazards reach the patient and cause harm. So in relation to our case scenario, the first loophole we've identified is improper handover. So patient information is not being properly passed down between staff. Secondly, improper delegation of staff. Work delegation was done without considering the staff's ability to perform them. Furthermore, no support or guidance was given to the new nurse. Lastly, the negligence of care. New nurse was overly task-oriented and only focused on the patient's medical issues. So what are the problems identified in this video? My next speaker, Yingwei, will elaborate more on them.
Thank you, Maureen. There are 3 problems shown in the video. First, improper handover. Second, improper delegations. Lastly, negligence of care. During the handover, ESPAs was not used. A lot of important information was left out, such as the mental conditions of the patients. The new nurse did not read back the order from the senior nurse after the handover to confirm what needs to be done. For improper delegation, the new nurse do not have sufficient experience. Despite that, the senior nurse still delegate the task to the new nurse without any proper guidance or support. Now, I pass my time to Isabel to talk more about the third problem, negligence of care.
Okay, thank you, Yingwei. So now I'll be talking about the last problem demonstrated in this scenario, which is negligence of care. So the new nurse was overly task-orientated, focusing solely on the medical aspects of patient care, such as pain and wound assessment. In our case scenario, the new nurse saw the suspicious Facebook page and text messages, but decided to ignore them. She neglected other aspects of the patient's condition. For example, she did not do a pill count. As such, she failed to detect that Ms. Tan was actually not taking her antidepressants. Psychosocial and spiritual needs were not addressed as well. Negligence of care also occurred when the nurse did not assess patients' mental well-being or check with the senior nurses about patients' history and condition, despite possible clues of suicide attempt. Now, I'll be passing over my time to Denise.
Thank you, Isabel. Now we have seen the problems, let's move on to our 3 solutions. The first solution is to improve staff communication. So during passing of report, the senior nurse could have also touched on Ms. Tan's past mental health history, which is a vital component in holistic patient care. The senior nurse could have also told the new nurse to assess for Ms. Tan's current mental status to find out how she's doing. So for example, if found to be at risk, Ms. Tan's worsening mental condition could be brought up to see if she'll need to be referred for institutionalization. So intervening early could ultimately prevent the inevitable, which is suicide. So next, the senior nurse could have also use proper handover techniques during the passing over of the report, such as SBAR, to ensure that no important information is left behind. So how can SBAR be used in this case? So for situation, senior nurse could say that for this home visit, Ms. Tan is due for wound dressing, and for background, she could talk about Ms. Tan's past medical and mental health history, and for assessment, she could tell the new nurse to assess for medication compliance, wound condition, as well as conduct a mental status examination. So for recommendation, she could let the new nurse know to inform her about any clarifications that she needs, or if she finds anything unusual with Ms. Tan's condition during the home visit itself. So the new nurse could also done a check back at the end of the handover to ensure that no important detail is left out. So I'll now pass the time on to Sherry.
Thank you, Denise. Now I'll be talking about the appropriate delegation of tasks. Firstly, this should ensure that the task is dedicated to a staff who is experienced and have the ability to assess the patient's conditions critically to ensure that holistic care is provided. Secondly, if the task is dedicated to a nurse who is less experienced, she should be accompanied by a senior to ensure that sufficient supervision and support is provided to ensure that any lapse in care by the inexperienced nurse is rectified immediately by the senior. Thirdly, the nurse should ensure that proper evaluation of the patient's physical and psychosocial condition is done before leaving, and not only focus on the medical aspects of the patient. Now, I will pass the time on to Jia Xing.
So the last solution is to conduct a holistic assessment of the patient's condition. It's important to have effective communication between the nurses, and this includes using SBAR during handover, and also to read back to ensure that important tasks will not be missed out, so that nurse can provide holistic care for the patient. A nurse should not only focus on the medical aspect, but should also assess the psychological, sociological, developmental, spiritual, and cultural needs of the patient. A nurse should never assume that things are well. In this case, the new nurse should have explored further regarding the patient's mental condition after noticing red flags in the patient's mental well-being. So in summary, we learned about the magnitude and extent of the problems that can arise if patient safety is compromised, and also the ways to provide safe care. First, by improving on staff communication using SBAR and also to read back. Second, to delegate tasks appropriately, and also to conduct holistic assessment of the patient's condition.
We would like to end by this famous quote: "You do not need to know the whole alphabet of safety. The ABC of it will save you if you follow it. Always be careful."